10:02. Yeah, I think we've got quite a few people on. So I'm going to introduce myself. Thank you everyone for joining in tonight. I'm Alexandra Azouri, co-founder at SUKU Vitamins. And here we have Dr. Marley Guy, naturopathic doctor. We're thrilled to have her here tonight. She'll be discussing hair loss in women.
Yes.
So we'll be touching various points on the topic hair loss in women, common causes, what's considered normal, abnormal, some tips to avoid hair loss, a few takeaways on how to improve hair health. So she'll go into more details. We'll be giving away 2 prizes at the end to people who answer a simple question we'll ask, and Nature's Fair will be randomly selecting those winners. And we ask you to ask questions along the way. We'll be happy to answer them, and that'll kind of guide our conversation based on the questions.
Okay, perfect. So
can everyone hear us okay? We just get a little
confirmation,
a little wave. Yes, we can hear you.
Okay. I think we were being heard. Okay. So we're going to start off by just going over some basics of hair physiology to get an idea of what's going on with hair growth, what does it all mean, and what to kind of look for when we're talking about hair loss and what's considered normal versus abnormal. So I guess the best way to start is to just really talk about what exactly is our hair. And it's actually pretty interesting. So our hair is actually made up of both a living and non-living substance. So the hair that we see on our head, like our lovely luscious locks, these are actually non-living keratinized epithelial cells. So it's purely just keratin, which is a protein. And underneath the skin is where we have the hair follicle. And the hair follicle is where all of the processes involved in hair growth actually occur. And this is the living aspect of our hair. So it goes, deeper than just what we see on, our heads. So with that being said, hair growth is also quite complex. We have various stages of hair growth, and our hair constantly is going through a stage of growth and rest. So there's typically about 3 different stages. So we start off in the anagen phase, and this typically lasts about 2 to 6 years, depending on a variety of factors. So our age, our hormone levels, our nutritional status, disease states. But essentially that initial phase is when actual hair growth is occurring. Then it goes into a transitional stage called catagen, and this lasts about 1 to 2 weeks. The final stage is the telogen phase, and this can last between 5 to 6 weeks, and this is when a new bulb in the hair follicle is actually starting to emerge underneath the current hair follicle. So the whole idea is to basically push out the current hair follicle and allow for room for new hair growth. So this is constantly happening throughout our life. And what happens is, in order to have healthy, luscious hair, we want to have the majority of our hairs in that initial growth stage. So we want 90% of our hairs to be in that anagen phase. What happens is, when the telogen phase, so the shedding phase, increases, that's when we run into problems with hair loss. So when we're losing more hair than we're growing, that's when we start to see the hair loss.
Okay, so we should be nurturing that first phase.
Exactly.
Which is, of course, nurturing it for a long time, for months, years. You're saying 2 to 6 years.
Yes.
So you want to be on a consistent regimen that would basically nurture your hair for that period, which is the building base for your hair follicle and hair health.
Exactly, yes. So there's a lot that goes into the hair health. And a lot of people wonder, well, what's considered normal hair loss? Because a lot of us, it is normal to lose hair on a daily basis. Normally, it's normal to lose about 50 to 150 strands of hair. Now, we don't just sit around and count our strands of hair every day. So how do we know if we're losing more than we should? So anything more than the 150 is deemed abnormal. But what that actually looks like is you'll start to notice actual physical changes, or your appearance of your hair will change. So it will be quite noticeable. Um, but essentially, you kind of have to reflect and think, am I losing more hair when I'm brushing my hair? Am I noticing like clumps of hair coming out in the shower? Is my ponytail thinner? Am I noticing bald spots when I, pull my hair back into a ponytail? Am I seeing scalp where I used to see hair? Or, is my hairline starting to recede? So you'll start to see actual noticeable changes when your hair shifts into that telogen predominant phase of shedding.
All right, so I know that I've had so many people ask me questions, and I've asked the questions as well. Hair loss. So currently, I know post-COVID, long-term COVID effects. I know so many people have asked. I myself had that happen because the body, a lot of hair loss post-COVID because of overactive inflammation in the body. I guess this inflammation causes a shift in hair cycle,
Yes.
causing you to lose clumps of hair.
Yes.
A significant amount of hair. I know so many people I've spoken to. I've just read a recent research, Hackensack University Medical Hospital, on one of the after effects of COVID.
Yeah.
Same with post-pregnancy. A lot of women experience that
Yes.
drastic hair loss.
For sure.
So now this is where we fit in. So as you said, we've got that nurturing phase of 2 to 6 years, but you want to stick to an easy regimen with key nutrients for hair health. So what would you say are the top key nutrients for hair health?
Yeah, so I mean, as Alexandra was saying, there's a lot of different causes of hair loss, and acute stress, like having an illness, having postpartum, hormonal changes throughout our life. Like there's all sorts of different causes of hair loss that we need to also take into consideration when we're talking about what's the most effective, treatment to address your hair loss, because it can be quite individual. But when we're talking about purely from a nutrient standpoint, which is also a major cause of hair loss. So besides the stress-induced hair loss and besides the hormonal aspect, nutrient deficiency is a large majority of the cases that we see for hair loss. So, dietary-wise, like protein is a major thing. So that's why I love collagen, because collagen provides those key amino acids that are truly the building block of our keratin, which is, again, what our hair shaft is made out of.
All right, and most people associate collagen strictly with skin.
Yeah.
So it's not just for skin, it's for hair as well, because it's one of the building blocks for keratin.
And also, when we think of, our hair follicle is within the dermis of our skin. So in order to have a healthy hair follicle, which is truly where hair growth occurs, you need to have healthy skin. So collagen kind of works as a double, double action there, where it's nourishing the skin cells that surrounds the hair follicle, and it also is providing the nutrients to build the keratin for the hair shaft. So I love collagen, and it's so easy to implement into your everyday.
And also biotin. Biotin is very well known. You hear of biotin for hair. It's had a great reputation for benefiting hair health.
Exactly.
So how exactly I know more or less how biotin works, how it stimulates keratin production in hair.
Exactly.
How it can increase the rate of follicle growth.
Exactly.
But from a more medical perspective, how would you describe biotin's role together with collagen?
Exactly.
In helping regain that hair loss, whether it's the normal everyday hair loss or it's the post-traumatic hair loss?
So you were actually right on there. So it actually is, its key function is to help with the keratin infrastructure. So it has a lot to do with the growth processes that are happening in the hair follicle. Biotin directly impacts our body's ability to metabolize amino acids. So it is basically working at the root, helping metabolize amino acids, breaking down those foods that we eat or the collagen that we consume. And it is basically, taking over from the collagen and saying, okay, I'm going to manufacture all of these key amino acids. So one that's rich in collagen is the hydroxyproline, and that is key for the keratin structure. So biotin's job is to basically metabolize those amino acids to build the keratin. And it's honestly been proven that in individuals who are biotin deficient as well, that it is very, very effective for regrowing, to see growth in the hair, as well as the hair thickness and strength. So, and one interesting thing that I've actually seen a lot of is whenever we see like a gut integrity issue, so gut flora is off, our gut flora actually produce biotin. And when we have a lot of gut issues, which is very common today, like a lot of people suffer with gut issues and flora imbalances, it can disrupt the biotin producing bacteria that are actually helpful for us. And then that can affect hair.
Okay, that's very interesting. So now by ingesting biotin, so say biotin, collagen, and a few more ingredients, which we'll touch on later, would that help replenish hair loss, whether it's due to trauma, whether it's normal everyday hair loss?
So the way I like to think of like the nutrient approach to hair is just, it's that solid foundation that we need every day. So like I said before, and I think someone mentioned down here that, you know, low iron is a big factor for hair loss, right? So definitely you need to address those individual factors. So if someone does have low iron, so if your ferritin is below 30, you will most definitely be suffering from hair loss, or your hair is not as full and luscious as it could be. So really optimizing iron level is definitely key. So making sure you've ruled out those major causes of hair loss, like the hormone imbalances, the iron, if you're protein deficient in your diet. However, we all need these key nutrients daily in our diets in order to have a healthy foundation for hair. So I love to supplement with these key nutrients, regardless, whether you have, you may not be deficient in protein or iron or anything like that, but to have these nutrients in our daily diet is really important.
Especially as a proactive approach, as opposed to addressing the issue, you have a proactive approach, something easy to take, maintainable with all the key nutrients you'd like. So we have a few questions in here that we're, does biotin stimulate hair growth elsewhere? So we've had a few people ask that, as well as a few people who have taken biotin who notice maybe a little bit more hair growth in other areas in your body.
So it's interesting because we do have different types of hair. So there's vellus and terminal hairs, and they respond to different stimuli. So terminal hairs is what we have on like our head, our men have it on their beards, our underarms, and the private areas. So they're like that thicker, coarser hair, and that is what is more responsive to like these supplementations, whereas the vellus hairs are like the peach fuzz on our skin. So that it's different mechanisms involved. So you're not gonna if you take biotin, you're not gonna all of a sudden notice hairy arms and peach fuzz. So yeah, it's different kind of mechanisms involved.
So it really will target the areas of hair that we want to grow.
Yes.
So I see that
biotin, how much is?
So here, we're going through a few questions here. How long would you need to take biotin and collagen to see results?
So again, like it's very individual. Everyone is different. However, if someone is biotin deficient, again, you may see results fairly quickly. Now, you have to also take into consideration the cycle of the hair, right? So it can take some time for the hair to actually go through its cycles, but you will start to notice, little baby hairs popping up. And that's a good indication that things are going the right direction. You will notice hair thickness. So one of the things that I actually love for hair thickness and strength is actually silicone.
Yes.
It is shown to improve tensile strength and increase the break load. So your hair is actually able to withstand more, pressure and, wear and tear, like it's stronger. And as a result, it's more elastic and you get thicker hair. So,
So silicone has actually been gaining popularity recently on Instagram and TikTok, usually in the horsetail plant, coming from the horsetail plant. So it's a mineral that works very well with collagen. I guess it plays a role in forming bone, hair, skin, collagen health. But the reason it's been growing on Instagram, TikTok, is it has this reputation for help reducing thinning hair.
Yes.
As well as nails.
Yes. It's basically really key for all connective tissues. So like you said, like the skin, the nails, and the hair. It's going to improve the elasticity and the strength. So that's really where silicone comes into play. I actually wanted to address this one comment here about what can I do to make my hair look shinier and healthier. One of the key ingredients for that is actually folate, which
that's very interesting.
And that's because folate has an amazing ability to, it's involved in the cell growth, and it is also involved in the development of red blood cells. So what happens is when we have increased red blood cells, we're able to actually deliver more blood flow and then more nutrients to our hair. So when we have more blood flow and oxygen and nutrients, what you get is shinier, healthier looking hair.
Okay, would that maybe explain why a lot of pregnant women have
glow.
that glow and that beautiful hair, shiny hair?
It's the folate.
It's the folate.
It's the
okay,
folate.
That's that's very interesting. We're going through a couple of questions here.
Yeah.
So we had one. I'm just going down the list. On the amount of biotin. So how much biotin is too much? Or how high of a dose of biotin should a person take? Or what would be the recommended dosage?
So biotin's kind of a tricky one because there is no real standardized recommendation in the literature. However, a safe dose to take on a daily basis is 2,500 micrograms to see noticeable difference in your hair. So often like the daily recommended intake is quite low compared to that. But again, biotin is involved in a lot of reactions in our body. And when we're talking specifically about hair health and wanting to see growth of hair, you do need that higher dose.
Yes, you do need that higher dose. And I do know that with Health Canada, I guess 2,500 micrograms is what they recommend. And I guess the maximum allowed on a daily basis, according to Health Canada.
Yes. And one thing I will mention for biotin, just, to look out for is anytime you want to, or if you're planning to get blood work done, I would recommend just avoiding any biotin supplement just for about 5 days prior, just because it can sometimes skew, like thyroid serum levels, but it's just that it interacts with the test result. It doesn't actually change your thyroid levels, but it's just something that I always make sure to tell people is avoid before getting blood done.
Very interesting. So now I'm reading a question. How long would you need to take biotin and collagen to see results? I guess we touched on that.
It's individual. But
it is individual. So I know that personally when I had COVID, about a month and a half, 2 months later, I started noticing every day, brushing my hair, showers, seeing, alarming amounts, clumps of hair coming out. This was about a year ago. Contacted my doctor because I didn't know what was
scary when it happens.
Everything was fine. Like all my blood levels were fine. Iron was fine. Hormones were fine. Everything was fine. I had mentioned that I had COVID, and that's when I was told that it is one of the long-term side effects from COVID.
Exactly.
I did address the problem. As you can see, this is my hair. I actually did take the SUKU. So I actually have a bottle right here. So it's the Luscious Hair, SUKU Luscious Hair. I think some of you are familiar with this product. So it was also developed by naturopathic formulas. So it has the biotin, 2,500 mcgs per serving. It has the silicone, the horsetail plant. It has the marine collagen, which is the most absorbable collagen. Of all the collagens, the hydrolyzed marine collagen is 1.5 times more absorbable than regular collagen. So it has all the things we've touched on. It has a few other things as well. Vitamin D, it has the vitamin C, it has zinc, and all of these different nutrients play a role with hair regrowth. So for me personally, it took about 3 months to notice a difference in hair. So I found I had new hair growth.
Mm-hmm.
I had stronger, thicker hair, and the falling stopped, like the shedding. When I would brush my hair ended. But what I also really noticed was my nails were just
Yes.
growing after like a week.
Mm-hmm.
I had long, long, strong nails, and that was the very first thing I noticed immediately. So I knew that I was, sticking to this regimen.
Yeah.
And after 2, 3 months, I really noticed a difference. I noticed it. My hairdresser noticed it.
Yeah, it's
So it
amazing
does
how your
work.
body responds when you give it what it needs, right?
Absolutely. And and you have to stick to a regimen.
Mm-hmm.
So, in the past, I know when I would, try a vitamin, I would maybe take it for 2 weeks,
Mm-hmm.
stop, then take it once a week, and once every 2 weeks. And then I kind of got that pill
It
fatigue.
just sits in the
And
cabinet.
exactly, it sits in the cabinet, and then, every year you're like, oh, this is expiring or expired, and you throw it out. So what I love about an easy to take format is that it's an easy to stick to regimen.
Mm-hmm.
And like compliancy, sticking to something every day for whether it's a month, 3 months, 6 months, that's really easy and that's enjoyable, makes all the difference because it's whether you stick to that program
Yes.
or not, that's when you'll see results.
For sure.
So we have a few more questions that we
Yeah.
would love to
Yeah,
to recommend.
did we miss some up here? Can you take them?
Okay.
Yes, you can take them all at once. They work they work synergistically. So all of the nutrients that we've talked about, the folate, the antioxidants, so the vitamin C, the vitamin E, the zinc, the collagen, the biotin, they all work synergistically to achieve, a healthy hair growth process. So they're definitely safe to take together.
And so how much should you take? So 2,500 mcgs is the recommended
Yes.
amount. And it's like one of the on the higher end of the spectrum.
Mm-hmm.
And I see a question that someone says they've seen as much of 10,000 units, which is really not necessary. 2,500 is really what you need, and it's even on that higher end of the spectrum.
Yes.
Anything over and above,
Mm-hmm.
and correct me if I'm wrong, your body will just flush out.
Well, that, and also I think a lot of products miss the power behind the synergy between like the different nutrients together. A lot of products just focus on high dose of biotin, but they're missing that key component of how they all work together. So that's why it's really helpful to get a formula that really has all of those key nutrients, because that's when it really works the best.
Well, it's true because you want that powerhouse of ingredients, that powerhouse formula. So it's not just the high biotin.
Mm-hmm.
It's the high biotin plus the collagen,
Exactly.
plus the silicon, plus the zinc, plus the
Exactly.
D
they all
and
have their
C.
little jobs
Because
in the whole
exactly.
process.
So they all have their process. And together, it's like that full formula you would need for
the powerhouse
for hair health.
Yes.
So
Okay.
going into more questions.
Dandruff and hair loss. So dandruff, yeah. Anytime we talk about hair loss, again, we want to think about where's our hair growing from, and that's our scalp. That's the skin on our scalp. So making sure that you have healthy scalp health is really also a good place to start when we're talking about hair health. So definitely, I would work with your doctor and see how you can best approach the dandruff, because that will definitely help facilitate better hair growth. Anytime we talk about like prescription interactions, I always just suggest please go and speak with your medical provider before starting any new product, really, because it's hard for us to say, over this kind of format. This is for educational purposes only, and we're not providing any type of medical advice. So any questions relating to interactions is best to be addressed with your doctor.
Absolutely. What are your thoughts on scalp treatments and oils? Is it effective?
I mean, I think doing a nice scalp massage here and there is very good for our scalp. It facilitates increased blood flow and it brings nutrients to our scalp. So of course, I think, you know, it can't hurt. And there's definitely oils out there that have been shown to be helpful.
And you want the oil to be as natural
Yes.
as possible, without any scents and without any other alcohols or any
No
other
irritating
hidden
products.
no
Yes.
irritating products. It's a good add-on.
Yes, I agree.
So you would want to treat internally with the ingredients we mentioned. But I do hear about scalp massages, but even brushing your
Yes.
hair. Brushing your hair, people don't realize, is a scalp
It
massage.
is.
And if you do it several times a day,
It stimulates the follicles.
It stimulates the follicle and will help with that
Yes.
hair growth. So it is effective as an additional treatment.
For sure.
Definitely.
Okay, so topical biotins.
Okay, do shampoos that contain biotin work in the same way as a biotin supplement?
So the research doesn't necessarily support that. It does point more in favor of taking it orally. Our body is better able to utilize it. It's more bioavailable. We basically are breaking down the amino acids within our bodies, and then it is producing that hair growth from within. Applying it topically hasn't necessarily shown to be as effective. But I think with any hair care product, just making sure you're having clean ingredients, not going over the top, doing too much, like keeping it fairly simple is, I think, the best way to go.
Perfect. I would have to agree with that. Keep it simple.
Yeah.
Can you please show the bottle again? Okay, Lori, this is for you. This is the Luscious Hair from SUKU. So they're like delicious gummies. They have a great amount of, as we mentioned, biotin, collagen, silicon, vitamin C, D, zinc. So a powerhouse formula. It's been extremely popular on social media, popular in stores as well. Very, very a great seller. People who have stuck to this for at least a month, 2 months have noticed an incredible difference in their hair. Thickness, shiny, less hair falling out, nails as well. And it also has great things for skin. It has your collagen, which is fantastic for skin. It has the zinc and the folate and the C, which end up helping your skin.
Yeah, it's great antioxidants, and like inflammation of any kind is definitely also a cause of hair loss. So anytime we can decrease our inflammation by ingesting the antioxidants, that's going to help as well. So that's kind of how those the vitamin C and vitamin E work. Aging and hair loss. I'm not sure if that's a question, but that's definitely a thing. Hair loss is a natural process that occurs with aging. However, doesn't mean that we have to like just let it take its course. Like there's things that we can do to help slow that down and to help nourish our bodies the best that we can so that we lose hair less quickly. So there's definitely things that we can do. It's not something that we just have to accept. There's always ways to improve our health and our beauty. So, aging is just a number.
Of course. And we can age gracefully and, with the right regimen, the right products.
Exactly.
Yes. So I'm going through the questions. How long does the one bottle last for? So the bottle has 60 gummies and 2 servings per gummy. So it's a 1 month supply per bottle. Going through all the comments. Can you take a silicone supplement for hair loss?
So silicone is very different than silicone. So silicone is what's commonly used in, like breast augmentation.
Yes.
That is a synthetic man-made polymer. It is very different from the element silicone that we ingest.
Okay.
So please do not take any silicone for your hair loss.
But maybe silicone.
But silicone is very good.
Also known as silica or horsetail plant.
Yes.
Which is the source of silicone, which we touched on before, for thinning hair, for healthier hair follicles.
Building those, it's providing those amino acids. Like it's very rich in the hydroxyproline, which is important for the collagen synthesis. So it really helps it's kind of that helper for collagen, and it
So
works.
that's
So
what I was
yes,
told. It works well with collagen.
yes,
It's the synthesizer for collagen. So when you have those two ingredients together, the collagen works a lot more efficiently with the silicone present.
yes, and it really truly is that key ingredient that is helping, along with the collagen and the biotin, but helping strengthen those hair shafts and increasing the thickness of the hair, improving elasticity so that it can withstand a little bit of, you know, styling.
Yes.
But you know, so it prevents breakage, right? Which is
Yes.
also very common, right? So even different hairstyles that we do sometimes can cause hair loss, right? Or over styling, like that's the whole point of the silicone, is that it helps improve the tensile strength.
Mhm.
It helps increase the break load so that your hair is stronger.
All right. So I see we have, what can you recommend to do with an irritated, itchy scalp?
So with this, I would actually recommend that you so hair loss, again, there can be so many different things going on. Whenever you have additional symptoms such as like the irritated, itchy scalp, if there's redness in the area, you may want to go to your doctor and just request, you know, your doctor to look at it and see if there may be some sort of infection going on. So sometimes like tinea can cause some scalp irritation and itchiness. Typically with other forms of hair loss, we don't get the itchiness. But however, if it's not infectious, it may just be that you have dry scalp. It may be psoriasis going on, eczema. It could be weather related. So, but just to be safe, I would just go and get it checked out.
Absolutely. I always recommend going to see
Yes.
a doctor, and in the meantime, maybe to stop irritating products.
Yep.
And,
maybe like there's something that's stripping the hair, like maybe
in the shampoos or in
yes.
other products that are being used in the hair.
Yep.
Whether it's shampoo or conditioner, until you see your doctor.
Yes.
We have a question here, and this is interesting because
Yeah.
I've always wondered this.
Yeah.
Could my hair loss be a result from wearing my hair up in a ponytail all the time?
Yes, for sure. And like, yeah, there's so many ways you could lose hair loss, and one of the ways is definitely just mechanical trauma. So that's like the tugging, pulling from the styling, heat, wearing your hair in a certain style over and over again. So like you said, like the high ponytail, especially if it's very tight, it's basically pulling on the strands. It's creating tension, and our hair follicles don't necessarily appreciate that over and over again. So definitely I would suggest giving your hair a break. Definitely not sleeping with your hair in a tight ponytail, because we move around and it's more tugging, but it can be a cause for sure. So hair health, yeah, hair care is important. Same with, you know, making sure your body has those nutrients, the key nutrients, as well as the hair care is important. So, you know, medical conditions aside, I think everyone can benefit from just taking key nutrients that are good for hair health, as well as, you know, being mindful of hair care.
True. So, that's something I had never thought of. But yes, hair up in a ponytail can be also So going through the question.
Yeah.
Okay, so someone was asking the exact same question.
Yeah, work related is tough. Maybe just try like a braid even is actually quite good. Like a loose like
or
braid,
a looser ponytail that doesn't pull too much. I know when I have a tight ponytail, it's not just the hair loss, but I get a headache.
Yeah, it
hurts. After a while, it practically gives me a headache. So which type or brand of collagen do you recommend? So as I was saying before, the type of collagen, the best type of collagen, the most absorbable, is the marine collagen, the hydrolyzed marine collagen, which is what is in the SUKU Luscious Hair vitamins.
And actually there's a lot of different types of collagen, even beyond like the hydrolyzed marine collagen. There's what's best for hair health is what's called type 1 and type 3 collagen. So like we were talking about before, like collagen is, you know, used for our ligaments, our tendons, but that's a different type of collagen that we use for, you know, skin and our hair. So skin and hair is the type 1 and type 3, which I believe is the type that is within the hydrolyzed marine collagen. So that is the type of collagen that you would want to be incorporating if you're wanting to see benefit for hair growth.
Perfect. Okay. That's good to know.
Yes.
Okay, so not a professional opinion, but I find that shampoos with SLS, sodium lauryl sulfate, in them irritates my scalp.
Yes.
I look for shampoos without them. They're not easy to find, but there are a few. So absolutely. So we were saying, before until you get the appointment with the doctor to have that in-person appointment. I mean, maybe some of the obvious things to wean out of your daily regimen are some irritants in shampoo, and I guess sodium lauryl sulfate is an irritant. 100 strokes a day is what they used to say 100 years ago or years ago. Yes, absolutely. That's the hair brushing definitely helps on top of, proper of taking these key nutrients. But definitely I have to agree, the 100 strokes, if you can maintain it every day, is fantastic. How much would some of the SUKU Luscious product cost at Nature's Fair? Is it only available in gummies, plain pill form available? So the Luscious Hair gummies, so they retail for $22 to $23.99. And for a 1 month supply. They are sugar-free. So just for everyone to know what makes our gummies so unique, so different than any other gummy on the market, to point out, we are not just sugar-free, but we are sugar alcohol-free. So sugar-free, sugar alcohol-free, all natural. No artificial fillers, no artificial colors. Everything is natural. And one thing that I always like to point out, and I see so many products out there, whether it's collagen or biotin powders, gummies, other formats that have sugar in them. So, we know that sugar breaks down the collagen in your body. So too much sugar, too much alcohol, too much sun exposure will break down the collagen in your body. So when you see products out there that are collagen gummies or biotin collagen,
look at the ingredients,
gummies or powders or drinks, and they have sugar. So the sugar directly breaks down the collagen, and they'll throw in collagen. So one is, it's really counteracting the other.
Defeating the purpose.
It's defeating the purpose.
Yeah, always check ingredients. Whenever you're looking for supplements, look on the back, look at the label, see what the ingredients are. If there's sugar in them, just don't bother, because it's defeating the purpose, and the last thing we need more of is sugar. It just produces inflammation, it degrades collagen, and it accelerates aging of skin and hair.
So yes, so it's defeating that whole purpose. So yes, read ingredients. I always encourage people, read, and whatever you end up taking, whether it's gummies or powders, make sure you read the ingredients. If there's sugar, that should be a no-go right away. The next thing is sugar alcohol. So they come in the forms of maltitol, erythritol. They are horrible for your gut health, for that intestinal flora we were talking about before.
Biotin producing.
So it's flora. It defeats, that whole purpose once again. If you're disrupting that intestinal flora with the sugar alcohol and affecting your digestive system. So it directly correlates with that, the biotin that your gut produces, with collagen, with everything works in harmony.
It's true, and gut health can spin tail into hormonal imbalances. The whole thing can just spiral out of control if we don't take care of our gut health. So avoiding sugar alcohol is definitely important, no matter what you take.
Yes, absolutely. So to answer that question also from Heather, plain pill form available? No, we are gummies, and the reason we are gummies is, 40% of adults have difficulty swallowing pills. Another 10% of people who can swallow pills experience what's known as pill fatigue. So, I've experienced this myself. I know my kids have difficulty swallowing pills, so that's, anything in pill format, forget it, that's out the door. So you want an easy to stick to regimen. So, even if you can swallow the pill, are you really going to stick to that for 6 months? I mean, I know very few people, including myself, who can stick to taking a pill every single day for 3 months, 5 months, 6 months, or longer.
It's true.
So when you have a really easy and enjoyable format that's clean, that's, doesn't have the sugar, doesn't have the sugar alcohol, has, everything is clean inside, you feel good taking it, and it feels like you're having candy or a treat. So it's a very easy to stick to regimen. Like for me, that, this is why we have not, gone with the pill format and stuck to gummies, because it's a much easier system. It's a much easier like compliancy rate.
Yep.
So we are going through more questions. We love that we have all these questions coming in. Thank you, everyone.
Joints as well. I believe SUKU has other formulations that are like more targeted towards joint health or inflammation, but collagen is always helpful for joint health.
Yes. So from Teresa, does it help joints as well? So the collagen, yes, and the
antioxidants are always
biotin do help with joint health. We do have a completely different product for joints, which is our turmeric, which is 1,000 milligrams of turmeric, and that is really just for joint pain, inflammation, and digestion, your liver bile. So that, that's what I would recommend for joint pain over the biotin.